Yet we have many who sit and argue, not this group probably.
Also, so when I was going through the literature, there was definitely a lack of studies that looked specifically at the role of massage therapy in interprofessional collaboration and, or discussing any aspect of that with regards to massage therapy. There are a few exceptions that I put at the bottom. And so I did really have to rely, because there was a lack of studies, I really had to rely on papers that looked just more generally.
Well, when I asked people directly whether they felt the anaesthetist was an important part of the labour and delivery team, the overwhelming answer was, well, yes, of course. Particularly because of their role in labour analgesia, and most of the labour and delivery professionals felt that labour analgesia was particularly important for the patient's sort of labour process in terms of how they viewed that process and how obviously comfortable that was for the woman and how it would impact perhaps on future pregnancies. However, our data shows that in fact many of the professionals perceive the anaesthetist as more of a transient or a peripheral member of the team rather than being integral to the labour and delivery team.
Well, so I think we know from a number of presentations today, certainly from the keynote this morning, that we see this growing evidence in terms of effective teamwork and collaboration can actually start delivering safer clinical practices, and can also, we're beginning to find some of the work that we're doing, some of the work that I've been doing with colleagues, doing systematic reviews of studies, that the effective teamwork and collaboration can also have an effect on improving health and systems outcomes as well. From the sociological point of view, a lot of professions get involved in interprofessional things because it's about trying to improve their professional status, try and move up the sort of professional hierarchy a little bit. The physicians are at the top, so why do they care? They're already there, they're sort of well remunerated for the things that they do. They actually, sometimes when you talk to them, they don't see there being many problems. Talk to surgeons, they don't see there being these issues going ahead. And that's a sort of privilege of position, because when you're sitting at the top, you don't see the struggles that go on beneath you. And there are multiple other reasons, I think, why it's hard. I mean, sometimes you get some, and two of the guys on the project team were like physicians, and they were champions, and they were doing great stuff. But getting engagement with others, some of their colleagues was difficult. But then again, some of the, there's a lot of scepticism about this stuff as well on the boards, or clinical areas from other professionals. So it's not uniformly across, but you do see a trend for those reasons in